This is the vial of testosterone. Looks like this. It's a little bit thick. What I want you to do is take an alcohol swab and swab the top of the vial to clean it. And then you're going to use this syringe, and without touching the end of it, which needs to stay sterile, as well as the top of the vial, get the needle that you're going to use to draw this up out of the vial. And it's an 18 gauge or a 21 gauge needle. It's rather large. You just screw that on until it's tight, and then you pull the cap off. And then what you do, you see that okay? Is you push this into the cork of the vial, and you just pull out some of the medicine like this and pull. What I want you to do is you're going to do 0.3 cc's twice a week, so you can see the gradations. Can you see that pretty well? All right, so pull it back beyond 0.3 and then push it so you see the bubbles come out of the needle into the bottle. So you're right at 0.3 there. That's what you want. Now I'm injecting somebody who doesn't need as much as you're going to have, so I'm going to push it down here to just this right here and pull this out. But you're gonna do 0.3. So when you have it, it should be down here to 0.3. So then I want you to pull the plunger back down out of the syringe so that that medicine that's up in the hub of the needle comes out into the syringe, and then you can take that needle off, unscrew it, and then get your smaller needle. This is a 27 gauge half-inch needle. Put your smaller needle on here. You need to screw it on really well. There's a little locking mechanism on there. If you don't, the needle will pop off when you're using it. So you see that bubble that's still in there, so just push the plunger. I'm pushing the plunger up so that that bubble comes out. The bubble won't hurt you, but you don't need to inject it into you. And then you're right at your dose. Okay, so now we're going to use another alcohol pad to clean the skin a bit. We're going to do right here on the abdomen. So a little swab on the abdomen. And then what you want to do is grasp it right there just a little bit. Can you see that? Okay, let me get my hand on this right. And then you see how I've got my hand positioned on the syringe? Just poke it right into the skin. And you have to push really hard to get that stuff in there because it's kind of viscous, and then pull it out. And that's it. So you really shouldn't need a Band-Aid or anything on the skin after that, but if you feel like you want to put one on, that's fine. You can see there's a teeny tiny little spot right there. You know, if you have a white dress shirt on or something, you might want to put a little Band-Aid on there, but that should be fine. And that's it.